Today I'll be discussing exercise intervention for addiction recovery. So what is addiction? Well, according to American Society of Addiction Medicine's definition of addiction, it is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. So something I want you to keep in the back of your mind throughout the first half of this presentation is, what if exercise intervention can be used as a treatment for addiction recovery? Prevalence. According to Addiction Center, almost 21 million Americans have at least one addiction, yet only 10% of them receive treatment. That's almost 19 million Americans that have addiction that are not receiving treatment. Addiction to alcohol and illicit drugs costs the United States economy over $600 billion each year. Addiction is a chronic disease which affects neurotransmission in the brain. So in short terms, addiction affects the neurotransmission in the brain of existing neurotransmitter pathways such as dopamine and serotonin. So it mainly affects the reward center in the brain, as well as memory and motivation. But there are two different ways to feed the brain's reward system. There's one way which is natural rewards, such as eating food, and then the other side is artificial rewards, such as drugs. There are many factors that can contribute to developing addiction, but genetic factors account for half the likelihood of developing addiction. The other half is environment. So as this picture is showing, the two factors as to why someone would start using drugs. Biology and genes accounts for genetics and mental health disorders and gender. And then environment, so that can be peer influences, the community, access to drugs, as well as home life. So those two factors will account for the likelihood of someone using drugs. As mentioned earlier, when someone starts to use drugs, that affects the brain's mechanics, such as the brain's reward system, motivation, and memory. And over time, they'll eventually lead into an addiction if keep using. So how does addiction affect the brain? So another factor is that there can be an emotional trigger as to why someone might start using drugs. And when they do, they'll start craving to avoid the pain that was caused by the emotional trigger. And then it'll eventually turn into a ritual. So when someone starts to keep using drugs, a neurotransmitter pathway will be created. And when keep using, that pathway is strengthened. Eventually, the brain will believe that the system is dependent on the drugs and that will need it for survival, and then an addiction is created. So how does addiction affect the exercise response? During the initial stages of recovery, some might experience cravings and withdrawal. Withdrawal symptoms include anxiety, depression, nausea, muscle aches, and sweating. The patient might perceive the withdrawal symptoms as a response from exercise and might be less willing to participate in exercise. So just like any other patient or client that you're working with, you need to make sure that you are motivating them and providing them with the correct information, specifically making sure that they know the difference of withdrawal symptoms and some effects from exercise, such as muscle aches and sweating. How does exercise affect addiction? Those who have addiction have damaged dopamine neurotransmitter pathways in the brain. Dopamine is the neurotransmitter that helps create a balanced mood and happiness. Aerobic exercise produces dopamine in the brain and can help repair and restore the previously damaged neurotransmitter pathways in the brain. In a research study done at the University of Buffalo, done by Thanos, he found that aerobic exercise has been effective in preventing the start, increase, and relapse of substance use. This picture is showing the effects of exercise on the brain. So there are increased levels of neurotransmitters such as serotonin, dopamine, all of the neurotransmitters that help uplift the mood and help counteract the effects of depression and anxiety, which can be withdrawal symptoms from addiction. There's also psychological effects such as heightened self-esteem and social aspects of exercise, which also help improve mental health. So in another research study done in 2010, the findings concluded that aerobic exercise can be used to treat drug dependence. So in this research study, they had a group of individuals that were abstinent from alcohol and drugs, and they implemented an aerobic exercise program for 12 weeks. So the graph on the left is showing the percentage of days absence for the individuals pre-treatment, so before the 12-week exercise intervention. And then after the exercise intervention, well, through and after the exercise intervention, almost 100% of the days the people were absent. It is very similar with the drug dependence on the right. So percentage of days absent, the findings are very similar. Pharmaceuticals can be prescribed to help treat the withdrawal effects of addiction recovery, and I'll be discussing how they affect the exercise response. So, pharmaceuticals can be used to treat drug withdrawal and detox, which happens in the initial stages of addiction recovery. Benzodiazepines have a sedative effect and are used to reduce anxiety and irritability. Antidepressants are used to treat depression and aid with anxiety. Clotidine is used to reduce sweating, cramps, muscle aches, and anxiety. So, are there any modifications for exercise for someone in the initial stages of addiction recovery? Well, in the initial stages, some might experience cravings and withdrawal. As mentioned earlier, the withdrawal symptoms include anxiety, depression, nausea, muscle aches, and sweating. So you want to make sure that your patient or client that's recovering from addiction, that they're staying well hydrated throughout exercise, and that they know when the muscle aches are from withdrawals and not from the exercise regimen. You want to make sure that you ask your patient or client prior to exercise if they have any withdrawal symptoms. Are there any special recommendations for exercise? So the research studies have shown that aerobic exercise intervention for addiction recovery has been the most effective. Daily aerobic exercise can help repair and restore the once damaged dopamine neurotransmitter pathways in the brain. Aerobic and body-mind exercises have been successful for intervention for addiction recovery. So examples of aerobic exercise include walking, running, cycling, swimming, and examples of body-mind exercise include yoga and tai chi. So this is the exercise prescription created. This was based off of the research as well as ACSM's guidelines. So you want to just have standard exercise testing for addiction recovery patients to create an effective exercise prescription, but no medical clearance is needed. 150 minutes per week of moderate intensity aerobic exercise as per ACSM's guidelines, but daily aerobic exercise is the most effective in help repairing and restoring neurotransmitter pathways. So I would recommend 20 to 30 minutes per day of aerobic exercise up until 150 minutes minimum per week. And 2 times per week, body-mind exercises. So I would make sure to include muscular strength activities and flexibility as well. So a good example of this is yoga. And I found in the research that it is most effective when following aerobic exercise. So for example, you could do running for 20 to 30 minutes followed by yoga. Case study for exercise intervention for addiction recovery. Scott is a 38-year-old male who is in the initial stage of addiction recovery. He has no pre-existing medical conditions besides depression, and he is cleared by his primary physician to exercise. Since he is in the initial phase of recovery, he is experiencing withdrawal symptoms of depression, anxiety, muscle aches, and sweating. He is currently prescribed Zoloft to treat his depression and clonidine to reduce withdrawal symptoms of anxiety, muscle aches, and sweating. He has no previous exercise experience. His goal is to use exercise as a mode of addiction recovery treatment. So Zoloft is an antidepressant, and clonidine, as mentioned, it helps reduce the symptoms of anxiety, muscle aches, and sweating, but you still want to make sure that he is staying well hydrated throughout his workout and making sure that his muscle recovery is adequate. So as mentioned earlier, the exercise test will be standard for the ACSM guidelines. So for the aerobic test, I would do a 1-minute walk test because he does not have adequate exercise experience, so I do not want to do a submax or a max test. 1 mile walk test will be fine. And then the same with resistance. I would do 10 RM muscular strength test for large muscle groups. And then for flexibility, I'd measure joint angles. Exercise prescription. So aerobic training, I would recommend starting with walking 6 to 7 times per week for 30 minutes at 50 to 60% of his heart rate reserve. As mentioned earlier, is very effective when aerobic training is completed daily for restoring and repairing neurotransmitter pathways. And for resistance and flexibility training, I would have him do at least twice per week, focusing on major muscle groups such as back squats, deadlifts, assisted pull-ups, and push-ups. If you know of anyone or if you are struggling with addiction, there are resources out there. I found addictioncenter.com to have a lot of great resources out there. And especially if you're working with a patient or client that is recovering from addiction, try to be as supportive as possible because it is very difficult to start an exercise program on top of going through withdrawals and detox. Thank you.